From fabulous Las Vegas, Nevada, this is Pod Therapy. Real people, real problems, and real therapists. You can submit your questions anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. This week we learn exactly how far Jim will go to avoid settling up on a lost bet. And now, broadcasting from the churn, I'm Nick Tangeman, that's Sydney, that's Jacob. It's time for some Pod Therapy.
Oh, an intro.
An intro for the first time in 5 years.
Yeah.
We introduced Jacob.
Kind of accidentally.
Yeah. Oh, well. Screw it.
You can edit it out.
Yeah. Well, let's do it again. No, I'm kidding.
Yeah.
No, we're not going to do it. We're not going to do it.
Keep
So-
it. I'm sorry. Didn't mean to interrupt.
No. You're replacing
Sydney.
Jim. You're replacing Jim. The expectation is that you're going to interrupt because that's what
Okay,
Jim
'cause
always
that's-
does.
And that's what I do.
And it's perfect. It's perfect. So keep doing that.
Okay.
So Jim is out tonight. He is not able to join us because he got his foot caught in a bear trap.
Mm-hmm.
So in his place, we have Sydney Smith is joining us. So Sydney, welcome back.
Thank you.
Second time on the show.
I'm happy to
you
be
are.
back.
You are. Did you know?
First guess.
No.
think.
No.
No. What?
We've had other guests.
Oh.
You are our first repeat guest.
Oh, I'm honored. Thank you.
Nope. I'm sorry, you're not.
You
Sorry.
lied to me.
I just remembered. I remembered
Welcome
Jim's
to our
mom.
Friendship.
I think Jim's mom was the first repeat guest.
Oh, and if you count Laura.
I'm the second repeat guest.
If you got
I don't count Laura.
Great.
Yeah.
I'm just the second.
You would if you had
guest.
books that you didn't want burned.
That's a long run, guy.
Yeah.
And see, now I have to explain it.
I know, because we get each
She's
other.
not. Yeah.
There's not much to explain. Laura's a Nazi.
She's,
We get each other. We've been
Yeah.
together for 9 years.
there you go.
Our friendship.
Exactly. So Sydney's joining us. So we did kind of a whole long introduction. We talked a lot about you on the Patreon part of the show. So if you want to hear more about that, please go to patreon.com/therapy. For as little as $1, you get the whole Sydney story, which was is very interesting.
It's a good one. It's a good one this week.
story. Yeah.
I don't always say the Patreon is worth it. This week it's pretty good.
Yeah. I mean, and 90% of the time that we say that, we don't actually mean it.
Yeah.
But this time we really do.
This time it's actually good.
This time it's actually good. So Sydney gave us a little, and just to kind of summarize, because we'll kind of talk a little bit more about this as we go. But you've got a new eating disorder clinic that you have opened up in Las Vegas.
Yeah.
Inpatient.
Inpatient.
Yes, and we're providing also 3 levels of treatment.
Oh, really?
So outpatient, IOP, and residential.
Okay. Excellent.
So-
And IOP is intensive outpatient.
Yes. Mm-hmm.
Okay.
Okay.
Yeah.
So you've got like a pretty good continuum of care there.
Mhm.
That's pretty good.
And I have some pretty awesome people.
Yeah, you do. I know some of
Fantastic.
your people.
I know.
And you
Yeah.
actually got a good team.
crew.
You got
Yes,
a-
I do.
And
I only work with the best.
And I just found out it's
Mess
officially the only inpatient
Yes.
eating disorder
Yes.
facility in Nevada.
Yes.
There you go.
The
Yep.
entire
Yep.
state. Yeah.
Entire
I was about to say
state.
Las Vegas, but it's bigger than that.
It's bigger. Yeah.
How far would one have to go outside of Nevada to actually get to the nearest clinic?
Probably the closest would be to be like Wickenburg, Arizona.
Oh, really?
Mm-hmm.
Wow.
Yeah. But they're
And I definitely know where that is.
Yeah. But they're pretty small.
Yeah, they're small. Yeah.
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 Wow.
And they didn't take my client, so got some beef with them. No, I'm just kidding.
Yeah, absolutely. Hell yeah. Check out patreon.com for that whole story. 'Cause that no shit, no kidding. That's a messed up story. And
Yeah.
I mean, I guess you can say the silver lining, it ended well
Well.
with the establishment of your program. But
Yes.
like your program was really kind of built out of necessity.
Organically.
Yeah, because
yeah,
it just
it was synchronicity.
it was this or nothing, and it was
Yeah.
you just kind of had to put it together.
Everything came together, and
Wow.
yeah, people came together. So we actually have some really good therapists, like I was telling you, Daniel Smith out of St. Louis, Missouri, and then Dr. Robin Ruth, and she actually just moved to North Carolina. So we have a good, a really solid telehealth program too.
That is awesome.
Yep.
Good for you. Yep. And we talked a little bit about Sydney growing up in the Cherokee Nation in Oklahoma, and what that whole experience was like, and how that kind of led you to where you're at. So please go to patreon.com and check that out. It's a great story. So let's go ahead. Let's dive into our first question. Oh, I should explain, Sydney. We didn't just pick her up off the street. She actually is a clinician.
Yes.
She's got training in mental health.
22 years.
Holy shit! Really?
Yes, now I know. I was like, dang, I'm old.
Wow. I didn't know it was 22 years.
Yeah, 22 years
Dang.
now. Yeah.
So what are some of the areas that you've specialized in and kind of worked in?
In mental health and gambling and community mental health and tribal gaming and
Okay.
working with tribes, building programs.
Right.
So that's what I like to do.
Definitely.
That's where I find my joy.
Yeah, that's awesome.
Yeah.
That's really cool. So we've got Sydney. She's going to help us out answering some questions because Jim, I forgot what happened to Jim. He couldn't make it because
trapped in the woods.
Bear trap.
Trapped in the woods. That's what it was.
He's
That's what it
lost.
was. Yep.
He's lost.
He's out there drinking his own pee somewhere.
Not because he needs to.
I don't know.
So if the show doesn't
He's got
happen
plenty of
next
water with
week,
him.
We're all out looking for Jim.
Yeah.
I'm not.
He's not.
I'm in a bar.
He'll take over.
I am.
Well, somebody's got to stay back here in case he comes back.
In case he comes to that bar.
Right.
Yeah, exactly.
We should have had some code words or something. Send smoke signals. We can find him that way.
Exactly. All right, our first question.
Okay.
Mental health concerns in a new relationship. Hi, I'm a 30-year-old woman dating a 26-year-old guy. We hit it off really well, straight from the get-go. We share a lot of interest and conversation was amazing. There's still a lot of love in our relationship, but as things progress, his struggles with mental health, anxiety, depression, he is medicated, are taking a toll. I've never dated anyone whose mental health affects their day-to-day life like his. I own a business, and he's been unemployed for the better part of 6 months. He opened up to me and shared that his last position took a toll to the point where he seriously contemplated suicide. I don't want to pressure him, but not working is making him feel like dog shit about himself. I've also noticed that he tells lies to cover up things affecting his mental health. For example, his roommate approached me to share that my boyfriend hasn't paid rent in 3 months. Not only hasn't he paid rent, but he used the checks his roommate wrote that were intended for rent as personal living expenses. I asked boyfriend about this, and he came clean, and he had to go to his parents for $6,000 in rent money.
Oh, like hadn't paid rent to the landlord.
Yeah.
Oh, so the roommate was paying him rent,
Yeah.
and he was supposed to pay the landlord rent. Okay.
Yeah, that's how I understand that. Yeah. So he had to go to get $6,000 from his parents because, in fact, he did spend all of his roommate's contributions while not paying himself either.
Yikes.
Paying for himself either. This bothers me on an even deeper level because he still goes to the bar and spends money I know he doesn't have. Our relationship is still fairly new, maybe 4 months in. I like this guy when we're together, but the way he's been living is nagging at me. It doesn't affect me directly, but I'm struggling to put out of mind to be present when we're together. Put it out of mind when we're present. Struggling to put it out of my mind to be present when we're together. Kate. Okay. So, a couple things stick out to me. Huh?
I got red flags.
You got red flags?
Oh, where? I didn't see any red flags.
These are the flags.
Red
So we thought.
It seems fine. I don't know what Kate's writing about.
So number one, I mean, we're new into this relationship, so we're 4 months in, so we're seeing some red flags. Let's compare red flags.
Yes.
What do you
okay. I would ask him if he's gambling.
Okay, I mean that's definitely part of it.
First
I mean,
one.
sounds like he's going to obviously he's going to the bar.
Yes.
Mm-hmm.
So I guess
Something's happening.
okay, yeah. So I mean,
And
there's
she doesn't feel comfortable.
right.
And I think that's the most important thing. Or
Yeah.
she wouldn't be writing in.
Yeah, I mean,
Yeah.
so here's the thing that kind of sticks out to me with this writer is the part of I almost kind of get like this sense of responsibility
Mm-hmm.
for his mental health and not wanting to push him too far, right? So I think that kind of sticks out from her perspective, as in like. He's told me about his mental health and how this is an issue. However, these are all the things that I'm seeing. How far do I really push him on these things? Because I don't want to drive his mental health someplace to an unhealthy place, right? And there's kind of a balance there, you know, where number one, you, Ryder, Kate, are not responsible for anybody else's mental health.
Right. Got to keep your own side of the street clean.
Right. Yeah.
That's
And so if these are things, if these are concerns that are bothering you, I would validate your concerns, validate your feelings. If I was in that situation, I would be concerned too. I mean, it's one thing to not be able to work because of mental health.
Mm-hmm.
It's another thing to have money and not being able to appropriate it to the right places, right? Which has nothing to do really with the mental health aspect.
Mm-hmm.
I mean, you could make an argument too that like sometimes that is a symptom of issues like bipolar or
Be
things like
something
that.
else. Right.
You know, where you
Yeah.
just like you can't manage money because of
Mm-hmm.
mental health.
Or
But
maybe
That
he
part
was
also
never
just
taught.
might be a budgeting app.
exactly,
Like,
yeah,
Might be one budgeting app away from fixing that part of the problem.
exactly, yeah.
It doesn't seem like it, but maybe.
Maybe.
Yeah, I mean, so that's kind of my take on that. Is like that's kind of where the struggle is, and I think. Again, you're not really responsible, but I think you're right to have these concerns, and I think you're also right to bring these up in that relationship.
Mm-hmm.
You know?
And be okay to talk about it.
Yeah.
You know.
Oh, and don't say it doesn't affect you, because I mean, it's obviously affecting you. I know what you mean, Kate, when you say it doesn't affect you. It's not like
Yeah.
it's not directly impacting your day-to-day life, but I mean, it's obviously affecting you.
It's like, you know, when you confront a suicidal patient, you know, you ask them, are you suicidal? You know,
Yeah.
it's okay to ask direct questions, you know.
That's
that's very important.
That is a great point,
Yeah.
because I think that's one of the things that number one, new clinicians struggle with, but then also just everybody in general, people who don't know anything about mental health really struggle with, because they
Yeah.
feel like if I bring it up, it'll put the idea in their head.
Exactly.
And that's not the case.
And it creates the elephant on the table.
Right.
Right.
Yeah. So
Yeah.
so there's no harm in bringing this up and discussing it.
Right.
And you can also bring it up in a concerned fashion, you know, where
Yeah.
like, hey, I really support you and your mental health. I want to be there for you. I want to make you know, I want to be somebody that you can count on. However, these things also have to happen.
Right. And
So-
it can create a mistrust within the relationship. If you're not trusting, you know, what's going on
Mhm.
and you don't understand, then it can create a gap. But
Yeah.
you're right. Sorry, I didn't mean to
No.
interrupt.
You're perfect. Yeah, you're right. I mean, so I mean, you have to be able to have these conversations. I really think it comes down to your approach, right? How you choose to approach it.
Yes.
And the other thing too that I again want to go back to is you're very early on in this relationship. This is 4 months,
4 months.
right?
He's
You're
like,
not.
Nick knows my go-to advice on all of these.
I saw him-
I have one piece of go-to
I
advice
saw
on all
his
these, and it's
eyebrow
cut and
raise.
run.
cut and run.
But it's you know, it's really gonna, Kate. It's really gonna be up to you to
Of
make
course.
a choice to what you do. You
Yeah.
know, but just be aware. Gordy would say awareness is the key,
Yeah.
Well, and
and that's it.
And there's another side to that short-lived relationship, or not short-lived, but so far it has been short-lived, and that is if and when you do confront is an aggressive word, but for the lack of a better one in my mind right now, confront this person about these things,
Yeah.
because I don't think the relationship is going to be able to progress until you do, until you at least settle this in your own mind. You're not going to be able to progress with this relationship, which means the relationship stagnates. But when you confront this person about these issues, it may be that he does the cutting and running. It may be that he says, no, fuck you, I'm not going to deal with you about this. We don't have that level of trust right now, and so I'm out.
Right.
And so,
right.
I mean, this may be a relationship killer.
Could be.
It could be.
So I'd say prepare yourself for that as well.
But being aware of, if you're not talking about this, we can all build resentments if we don't talk about stuff. And resentments is a killer.
If you leave it alone, it's definitely a relationship killer.
Oh yeah.
If you deal with it, it might not be.
Yeah, because
I mean-
I had that thought too. Like, okay, so if Kate doesn't do anything about this, two things are going to happen, most likely. Maybe not together, but they probably will. Number
Will.
one, resentment
Right.
will grow.
You're eventually going to hate it.
Right. Yeah, because it's going to be frustrating. Yeah, you're gonna build that resentment, and no healthy relationship is going to start off on the foot of resentment.
Yeah.
Never.
The other thing
Resentment kills everything.
the other thing that could happen, maybe along with resentment or maybe in place of resentment, is enabling behaviors, where you start you kind of find yourself, well, I'm in this mix.
Oh, I was so scared that the letter was going to go on and say that she paid the rent.
Oh yeah,
That she
yeah.
paid the 3 months rent.
And
I was so relieved when he had to go to his parents to get the money.
Yes.
I was like, oh, good.
Yes.
At least we're not there.
So
Yes.
parents did a bailout.
They did.
Yep.
They did. And I think this is kind of where I too am glad that Kate didn't do that, because what can happen is Kate could get into this relationship and we could see what we call cognitive dissonance, which is where our beliefs don't match our behaviors. So she has this belief that he should be independent and on his own, but then she starts behaving in ways that kind of start supporting it. And then so she has to reconcile those two. And that can sometimes lead to the enabling behaviors where she starts to, she starts to make excuses for him, start paying the bills and stuff because there's no other way that she can validate being in this relationship with somebody who she wouldn't want normally be in a relationship with,
And to be cautious because, when you're in a relationship and you start building resentments, then it can also make you sick.
Yeah.
Too.
Yeah.
And so,
Sure.
I mean,
she could start developing unhealthy behaviors.
right. I mean,
She's not careful.
a lot of your work has been with family members
Yes.
for gambling. And so you've definitely seen a ton of the resentment. And yeah,
And I've been there.
yeah, you've been there yourself.
I've been there, I know.
Yeah. And so that can be incredibly harmful.
Yeah,
over
you have to
long-
be very,
wow.
very careful. Yes.
Yeah.
Yeah. And just being aware, it's going to probably be her biggest thing.
Definitely. Yeah,
Yeah.
I can totally see that. That's going to be a tough situation to
Yeah.
kind of work through. But
But
Yeah.
I think we all agree that Kate needs to talk to him about these issues that you're having.
I think so.
Communication would
Eh,
be key.
I
Yeah.
think
'Cause if you can't-
And an angle, Kate, that you can talk to him about it is go to him and say, you have your issues, but I need to talk to you about some of my issues. And I have issues with some of the things that I'm seeing you doing and everything. And I need to talk to you about this from my perspective.
I feel when you,
Yeah, exactly.
and that's it.
You
Start
don't
out
have
like
it,
that,
it doesn't
right?
have to be a confrontation about like
No.
you're not paying your rent, you're having to go to your parents for rent, and I don't like that. It is no, I'm seeing
And-
these behaviors, and I need to talk to you about that, and I need to reconcile this before we continue on moving forward with our relationship.
Yeah.
And just her being aware of her feelings. Like, what is she feeling? Identifying it,
Yep.
Is it resentment? Is it anger? Is it frustration? What is it? And then she can go from there
Yep.
and let him know what she's feeling.
Yeah, I totally agree. And we're going to be talking about creating some healthy boundaries if this relationship continues and
Yeah.
and how you go from there. So I
Yeah.
think that's going to be very important.
And sometimes it's about saying, it's not okay to treat me like this.
Yep.
Yes. Yeah.
And that's okay.
Yeah, absolutely. And I don't think you have to feel responsible for anybody else's mental health either.
Right.
I think that's really
No.
important. We're obviously
And we
very
all can, easily.
Oh,
Yeah,
absolutely.
we can all feel responsible for
I mean,
people.
I think you just come at it from the point of love and concern
Mhm.
that this is how you feel,
Mm-hmm.
and that's all you can do. You can't avoid talking about it just because you're afraid of what they might do.
Right.
Right.
I think that's kind of where we're at.
It's self-care.
I got to tell you, I
Exactly.
feel like I feel like the answer to that question was about 33% better than the answers to our questions usually are.
I would agree.
Yeah,
I would
yeah.
agree.
I don't know
Yeah.
what's changed, but
I don't know what's different.
but
It's me.
it's
It
just
33%
feels
better.
It's me, of course.
All right, well,
Just
we
kidding.
we are going to take a quick break, and when we come back, we're going to ask a question about faking it.
Oh, gosh.
You're listening to Pod Therapy. This week's producer sponsors are Smitty Scoop, Jake Schneider, Carolyn Albert, Kevin Chamberlain, and Ben Stanley.
Hey, everybody.
Hey, if you would like to sponsor the show, become a therapy producer at patreon.com/therapy. All right, you're going to like our trivia question this week. Our trivia question, our theme is phobias.
All right.
Okay, I'm going to name the phobia, and you got to tell me what it's a fear of.
Do we have choices?
Yes.
Okay.
Oh,
I wouldn't do that to you.
Oh, boy.
All right.
I had a phobia of that for a moment.
I did too.
Astrophobia is a fear of what?
The dog on the Jetsons.
No.
Final answer.
I'm pissed.
Is it A, peanut butter, B, thunder and lightning, C, sleep, or D, insects? If you'd like to join the Therapy Producers and make the show possible, go to patreon.com/therapy and sign up. Again, that's patreon.com/therapy.
All right.
Astrophobia. Not Astro, which was the name of the dog.
Ah, now I feel ridiculous.
I just had some bad thoughts. I didn't know.
Ass phobia. All right, so it was sleep.
Peanut butter, thunder and lightning, sleep, or insects.
Is insects really a word?
Insects, like the bugs.
Insect. But did you think incest?
Insects.
Oh, insects.
Oh.
No.
Insects.
Yeah, no. It's the mask.
Oh my gosh.
All right.
I'm crying right now.
I'm gonna take insects off the table
Okay.
because I feel like I would have heard of that one.
Yes.
Okay.
I feel you got arachnophobia and all that. Like I feel like I would have heard about insectophobia
Now,
before tonight.
does it?
Insexophobia.
Yeah.
Does it?
It's a new one. We just gonna put it in the DSM.
I like your theory. I like where your head's at, and I'm gonna go ahead and destroy that right
Okay.
now. Because every one of these actually has a phobia.
Oh no, I believe that.
Oh, okay.
But I feel like this would have come up. Okay, my logic doesn't make any sense.
No, it doesn't.
I understand what you're saying now.
Just give us the answer.
All right.
What's your guess? Do you have a guess?
Astrophobia.
What were the options again?
Peanut butter?
Laughing too hard.
Peanut butter, thunder and lightning,
Thunder and lightning.
sleep, and insects. So you're going with thunder and lightning.
Yeah.
I'll go sleep. I'm thinking like astral plane.
Wait, is this really in the DSM?
Yeah. No, it's not in the DSM.
Oh.
No,
Okay.
no.
Okay.
Because
Okay,
phobias aren't in the DSM, but these are just
Impulse control disorder.
yeah.
Not otherwise
Isn't like
specified.
Right.
astral plane and all that kind of stuff related to sleep and dreaming?
Sounds good.
Fine, that's where I'm at.
Okay.
All right. Who's right? We're
Sydney
both wrong.
wins.
Ah!
It's B. It is thunder and lightning.
My backup guess was going to be peanut butter, so I was way off.
Peanut butter is okay.
I
I'm gonna
would be scared of peanut butter.
Jiffophobia.
Like
I wish it was jiffophobia.
How does that even work?
Peter
You wake
Panophobia.
up and you're smothered in peanut
Okay,
butter.
it's arachibutyrophobia. Arachibutyrophobia
Easy for you to say.
is peanut butter. Somniphobia is sleep.
Okay.
Yeah.
And insectophobia
It's
is
just
insects.
insectophobia.
It is.
Insexophobia. Yeah.
Insexophobia.
We'll get it in the DSM next year.
We'll find it. All right. Our next question, also from Kate, but a different Kate.
I was about to say, same Kate? No.
Nope,
No,
different Kate.
uh-uh.
It's an all Kate episode.
All right.
Faking it. Hi guys, love the podcast. I've been listening since your Reddit AMA back in May and recently became a Patreon.
All
Yes,
right.
I
Thank you,
recognize
Kate.
that name. My
Kate?
name is Kate, K-I-K-A-I-T. That's how I recognize it. Kate, I'm in my early 30s and my pronouns are she and her. Thank you for that.
Cheese.
My question is about feeling like I'm faking it. Apologies in advance for how long-winded I can be. For some background, I've been working with a therapist for the past 2 years. I absolutely love her, and I've had a diagnosis of complex PTSD.
Well, there goes our only piece of advice. Our only piece of advice on this show, Sydney, is get a therapist.
Yes. Yeah, I
And
know.
come
That's
to our center.
that's usually our go-to.
We can help you with that.
However, my history with mental health system has been rocky at best and may have contributed to my PTSD. I feel like I've had every diagnosis in the book, which from my understanding is not uncommon with CPTSD. I've had a big list of traumas, and most of them are little t rather than big T, though I have a few of those as well. The problem is, I consistently invalidate myself and question if my trauma was real, that bad, if it was really that bad, or if I'm blowing it out of proportion. Cognitively, I know that this is at least partially because of my dramatic and attention-seeking by my mom, who has been diagnosed but untreated borderline personality disorder for most of my life. I even have a screenshot of it to remind myself when I'm questioning myself. In a way, meds and therapy have made this feeling worse because my depression and suicidal ideation have gotten better over the past couple of years, so clearly it wasn't the trauma, right? At the same time, I wonder if I'm faking the depression too. I don't just invalidate the trauma though. I'm queer, and I often question if I'm making that up for attention too. I have always had massive imposter syndrome, though college and in my work life, despite a high GPA and other achievements. I'm doing it with grief now. 2 months ago, my stepmom passed from cancer and COVID. Then 4 days later, a 19-year-old cousin was found murdered. A cousin who I nannied after his mom died of cancer when he was 6. I have trouble calling it grief or accepting that it's affecting me because people who are close to them seem to be doing better now. The only progress I've made in this feeling that I'm faking it is accepting that I've had some disassociation and that my mom has used gaslighting against me. I don't trust my feelings or perception. I'm at the point where invalidating my experiences is blocking my progress in therapy. How would you approach this sort of feeling with a client, and do you have any suggestion on things I can work on outside of therapy to move past this feeling? Thanks, guys. Kate.
Wow.
That's a lot.
That's a lot.
So, okay.
You go first.
All right. Let me just collect my thoughts here.
Yeah, I know.
I think
I'm trying to process right now.
Yeah, I mean, the one thing I hear a lot in this letter, Kate, is I'm hearing a lot of you trying to understand your position based off of what you think other people's perceptions are. Do you know what I'm saying?
I heard that too.
It's kind of like I'm not sure how I feel about this, so let me check in with Jacob and see how Jacob feels about this, and then I compare how I feel to what I think Jacob feels.
Well, she said with the cousin's death that there was definitely just direct comparisons.
Yes,
Yeah,
exactly. Yeah, checking in with like how other people
feel like she feels like other people are getting over it faster than she is.
Yes,
and so she's questioning things
now
based on that.
I think is a fair thing to do, and I think it happens quite often with grief.
Sure,
right? I think
especially in the last couple of years, you know,
yeah,
because a lot of us have experienced deaths.
Absolutely. Yeah, I think that's kind of a normal thing to be experiencing and going through.
Mm-hmm.
And I think the thing that kind of where it really catches my attention is with all the other things as far as like the PTSD. Am I just making too big of a deal out of it because I'm attention seeking, or my sexual orientation? Am I making too big of a deal out of it? Am I over, if I'm trying to get attention, attention seeking from that as well. So obviously, I think, Kate, you've definitely got the message from other people quite often about attention seeking. And I think now you're seeing everything through that filter.
Mm-hmm.
So my first take on that would just be to just be able to kind of sit down and take a look at something for how it affects you, and that's it. And try to stop yourself from trying to see it through a filter through which you think other people are seeing it. Because whether or not, I mean, especially like if we talk about trauma, for example, what is traumatic? Well, that varies depending on the person. And we've seen this even in research studies with soldiers returning back from war, where, two people can experience the same thing. They can be in the exact same situation. One person will come back with PTSD and the other will not. And there's a lot of different factors that factor into that. But that doesn't invalidate that person's PTSD because the other person didn't experience it. So to some level, we kind of have to start tuning some of that out because it becomes irrelevant how other people are affected by something.
Also, at some point, it doesn't matter if you're exaggerating these things or not, right?
Yeah.
I mean, you still got to deal with it.
Yeah, exactly. So if it, the thing that we always say on this show, when is something becoming a problem? Well, it becomes a problem if there's a clinically significant amount of distress.
Yeah.
That exists regardless of whether or not you
If you've made it all up,
yeah.
you still got to deal with it.
When I was a
still
kid and my
relevant.
parents got a divorce, that was traumatic for me.
Yeah.
And I think there's different levels of trauma,
Mhm.
and so we can all experience those traumatic experiences in our life. but we have to honor them, like look at them
Yeah.
and not be afraid.
And I don't know if you've had this too. I'm sure you've had similar experiences with people you've worked with, but
Yeah.
I've had this experience a lot
Yes.
with where I've had clients that will say, yeah, this was a really traumatic experience, for me, but I know other people go through a lot worse, so I shouldn't feel this way about it.
Everybody goes through worse shit. There's always people who are going through worse shit than you. Who
Exactly.
cares?
Exactly.
They're dealing with their shit. You deal with
But
your shit.
What is
Yeah.
big T and little T, and has she talked about it? Has she been able to process through what that is and just share it with somebody?
So she did put a little bit more information that I didn't put in the email.
Oh, okay.
So she did talk a little bit about, because she asked not to put it in there,
Okay.
but she did give some examples of some of the trauma, and it's
Mm-hmm.
she's been through a lot. I mean, it's
Severe.
a wide range
Okay.
of
Okay.
stuff, So
Yeah.
I think, whether it's big T trauma, little T trauma, I think it probably doesn't do us any good to really kind of separate any of that, right? I mean, because it's
Yeah.
all, from her perspective, or from your perspective, Kate, it's all real, right?
Yes.
It reminds me of one thing that
It is.
a former medical director that we both had said once when he was talking about pain at the pain clinic, and talking about, well, is this real pain or is it not
Is it
real
not
pain?
real pain?
And he would always say, all pain is real pain.
Is real pain, yeah.
Yeah.
But emotional pain and physical pain run off the same receptors.
Exactly.
So sometimes it's confusing to figure out what it is.
Which is,
Yeah,
which is really something interesting that I never really realized until we started working with him, was that from the brain's perspective, the brain doesn't interpret pain, emotional pain, and physical pain differently.
No, it doesn't.
It's all
And it recognizes
pain.
it all the same. Yes.
Right.
Yeah.
And so I think that would be the first thing I would think of. Do
Yeah.
you have any other thoughts for Kate?
Yes, to start working on like really being confident in herself and believing in herself and not caring what other people think and going for what she really knows, because I've had other clients that have kind of had similar situations, and it was really just because they had feelings toward one way, but they were having this pull, just like you said, to go another way. And once that comes together, then they can find their own way. It's their own path.
Yeah.
It's like my family, like I had to find my own path, and it meant leaving, but and it was hard.
Yeah.
It is hard.
Yeah.
And so, I mean, my story, but so to find that and really that's like soul work,
Yeah.
It's not therapy work, it's soul work.
Yeah. Well, I think part of it too is just going
Sometimes.
along and just kind of trusting the process.
Yeah.
Because I think that's very difficult sometimes, where you're trying to guide something, and as opposed to just kind of that radical acceptance.
Yeah.
We've talked in this show quite often about mindfulness meditation, and maybe that would be something to kind of take a look at. And it's just kind of this way of accepting something and just coming to terms with it, realizing it, recognizing it, but removing the meaning from it. And that's, I think, one of the things that I hear a lot in this letter is a lot of meaning. Like, I have this trauma and this means this, or it means that. And just to be able to kind of remove some of that and just be, well, I have this, or this is how I feel.
I experienced this.
Yes. And so I'm not going to say
this on the radio, but this sounds like a person that would really benefit from going to ceremony or a sweat or ayahuasca, because that work is so deep, when you do it.
Maybe.
And it's like doing 30 years of therapy in one night.
I've never done it. You've asked me to do it,
Yes,
and I can't. The idea of it's just,
it's scary.
It's
but
scary.
You have to be ready to face.
and you have to be ready to vomit, and I'm not ready to vomit.
or go the other way.
Oh yeah, that's true.
Yeah.
I have a suggestion here, and it has to do with what Kate was saying about being feeling like she's being dramatic about some things. That wasn't your word, Kate. Forgive me. I don't remember exactly what your word was, but my word is being dramatic about it. And looking for that attention possibly and all of that. And that and I think it kind of goes along with what Sydney and Nick were just saying about a lot of other things too. And that would be, if I were you, I would try to be less worried about putting labels on all of these things. Just accept, I would work on accepting, just this is the person that I am. I have things that I want to work on. And don't worry about putting that specific label on what that is. Don't worry about saying, this is my sexuality, for instance. If you held a gun to my head right now, Nick, put the gun away.
You said it.
I said if. I said if, Nick.
I take orders.
If you held a gun to my head right now, I could not label exactly what my sexuality is. Don't sweat it. It doesn't matter what your sexuality is. There's so many of these labels that just don't matter at all. Because if I say, I'm bisexual, I'm gay, I'm heterosexual, I'm whatever, at the end of the day, who cares? It doesn't matter what that label is. Yeah. It matters that I find someone and that I'm happy with them, or that I don't find someone and I'm happy with myself, or whatever it is. Those are the things that matter.
Yeah.
Right. And I just had a thought that just popped up, and it was like, it's one of those sayings is like, what you do does not define who you are. And it's like, we are a person, and so we have choices.
Right.
We have choices.
Yeah.
That's it.
Yeah.
And we can choose.
Yeah.
Yeah.
Exactly.
That inner peace, that inner acceptance, if your therapist wants to put labels on things for insurance paperwork and everything, let them do that.
Yep.
Yeah.
That's their bag. That doesn't need to be your bag.
Not be your
You're
label.
paying somebody to do that for you. You can stop it.
So sometimes, you have to find the biggest, closest fit, if we want to help.
Yep.
How do you explain that?
Yeah. No, and you're exactly right.
And it's not a label,
And that's something that we've talked about before in the show, is just the fact that, sometimes we get really caught up in the diagnosis, and really the diagnosis is not It's not very relevant from the patient's perspective. It's relevant from the therapist's perspective.
And the insurance.
So that the therapist, a couple of reasons why we do that. Number one, so that we can communicate to the insurance company what the symptoms are.
Mm-hmm.
The other thing that's useful for a diagnosis is it gives us a language in which to speak to summarize a cluster of symptoms. And that's really about it, because
it's just boxing it out.
Right. From the patient's perspective, it doesn't matter.
No.
What really matters to you is, are you living your best life? Or are there obstacles in the way preventing you from living a more productive life, or from being happy, or whatever it is that you want to be, and just removing what those obstacles are. And from that perspective, again, I think a lot of it kind of goes back to the meaning of things, where we don't have to put a meaning on something. If I feel stressed when something happens that reminds me of something that happened when I was younger, it doesn't have to mean anything. It's just, this is how I feel. This is how I feel. That's it.
And it's not a contest.
And
it's not a contest with anybody else.
Activated.
Yep. Yeah.
Something can trigger us. We can be walking down the street, see a sign, activated, something, bring back the past. Yeah, it's everybody. Yeah.
But I am very glad, Kate, to hear that you are already in therapy.
Yes.
I'm glad to hear that the suicidal ideation is getting better, and that's starting to get over.
Yes.
That's starting to pass. One of the things that you said is that the meds and therapy may have made the feeling worse because your depression and suicide have gotten better over the past couple of years. So clearly it wasn't the trauma, right? ? I don't think there's enough there to really be able to say it wasn't related to the trauma. It could still be. Meds and therapy have a huge impact on improving those symptoms. So.
And sometimes it takes time.
Yeah.
Too.
Yep.
I mean, it could be, time has passed since the trauma. That could be a part of it. The meds could be a part of it. At the end of the day, you're feeling better.
Yeah.
I'd say focus more on that than on what the root cause of what the initial problem was in the first place. You know what the problem was. You know what the problem still is. At some point, the cause of that problem, the cause of that problem matters as far as discussing it and treatment and everything else goes. But at some point, that cause becomes the bigger problem then the root. The problem is the problem. You know, the symptoms are the problem, and the cause is not necessarily the problem that you need to dwell on.
Yeah, and looking at this from like a solution-focused brief therapy perspective. So solution-focused brief therapy is a therapeutic model developed by Insoo Kimberg, Steve DeShazar, and Stephen Miller, I think. But one of the things that they would say if facing a question like this is saying that if the depressive symptoms are going away and the suicidal ideation is going away, that's all that you need.
Yeah,
right?
sweet.
Because
Progress.
Yeah, because one of the things that we tend to do as human beings, we have this need to understand things, and that's not always a good thing. Like, we don't have to understand why the depression is going away or why the suicidal ideation is going away. We just know that it is. And if we know that and we can replicate it, understanding is useless.
Mm-hmm.
It's about replicating the behavior that we know works.
Oh, and also you're a more complex person than that. You're not going to be able to say, oh, this symptom is caused by X. You know, this I had trauma and that caused depression. No, you're an incredibly complex individual.
Mm-hmm.
There are a lot of things that went into the depression. There are a lot of things that go into every aspect of you, and you wouldn't say that your personality is caused by a single event in your life. You would say, well, my personality is the result of all of these different factors playing into it. This is the same thing. There's a whole lot of factors that go into it. There are a whole lot of factors to get out of it.
Yeah, exactly. So thank you for writing in, Kate. Hopefully you got something useful out of that. And
And
keep
you have
us...
solutions.
Yeah,
too.
Absolutely.
You know,
yeah.
it's okay. It'll be okay.
Trust the process. I mean, I would talk about all of this with your therapist and make sure your therapist is, kind of up to speed. And I think you're doing great, honestly.
Yeah.
I think if we focus a little bit less on other people's perspective of where you're at and focus on, are you happy with where you're at? Are you happy with the progress you're making? I think that will help quite a bit.
Progress, not perfection.
Exactly.
Yeah.
All right, well, we are going to take our second break, and when we come back, we are going to talk about my therapist is in a band. Hell yeah.
Get a new therapist.
What? Your therapist?
You're listening to Pod Therapy. This week's Theraproducer sponsors are Smitty Scoop, Jake Schneider, Carolyn Albert, Kevin Chamberlain, and Ben Stanley. If you too would like to sponsor a show, go to patreon.com/therapy and sign up as a Theraproducer, and we'll say your name. This week's second question about phobias is: cynophobia is the fear of what? And I'll spell that out. C-Y-N-O, phobia. Is it the fear of gravity, the fear of home, the fear of marriage, the fear of dogs, or the fear of Leonardo da Vinci? If you'd like to join the Theraproducers and make the show possible, go to patreon.com/therapy and sign up. Again, that's patreon.com/therapy.
Dogs.
Cynophobia.
Are we on break
I'm going dogs.
Yes.
officially? Okay. Because
You got to use the restroom?
I was like, yes, I
Oh.
do. But I was like, sinuses.
we're not...
A fear of sinuses.
Oh.
Oh,
I
yeah.
mean, that sounds...
But then you spelled it out. Then I was like, oh.
Oh,
Yeah.
yeah. No,
I
yeah.
was like, I have sinuses right now.
Cynophobia. C-Y-N-O. So you're saying dogs.
I'm going dogs.
So
And-
you've got...
Can I?
Yeah, go ahead.
Okay.
Go
I'll
ahead.
Be right
We
back.
will we'll riff.
Okay.
Yeah.
Okay.
Yeah,
Don't
we'll-
forget to take the headphones off, or you're not going to get very far. You're tethered down to the table.
I'm like, this is too high tech for me.
You're doing fine.
I'll tell you
Cynophobia.
what my thought about dogs are.
Please. Oh, it's
Well-
right across the
Oh, it's right
hallway.
there. Yep.
Okay.
Yep.
And that is, I'm thinking like Roman myth,
Okay.
Greek and Roman myth. I'm thinking like Cerberus and things like that, which I think the spelling is different, but I know the English spelling is different. But Cerberus was the Hades dog that guards something in the underworld.
No shit.
The 3-headed dog
Oh, really?
of Hades and Pluto in the Roman myth.
God damn. That's way more thought than I thought.
That's all I got. That's all I got. I don't have any reason behind anything else.
Okay.
So I'm going with that. because maybe the spellings are similar in some translation.
You could be right. You
Yeah.
could be right. And so you're going to rule out Leonardo da Vinci.
I'm ruling out Da Vinci hesitantly.
All right, fair enough. And let's just say she also said D. You both win. Congratulations. It is dog.
Oh, I can't believe I got it right.
can't-
I wonder if my logic is even close to right, or if it's just blind luck.
I don't know. That is a great question. We should look that up at some point. We're not going to.
No,
but
we won't.
we'll just say.
Actually,
it
I
is.
might.
Yeah.
How do you spell it?
CYNO.
CYNO.
Phobia. I wonder if what CYNO itself just means. If that has a meaning, you look at that. I'll.
Let's see here. Overwhelming fear of dogs. Yeah, no, I know that part. Let's see.
Oh, well, it just says related to dogs. If you look up the definition for cyno. Oh, it's cyno. Cynophobia. So.
All right. Let's see. I've got irrational. Boy, sure does tell me that it's an irrational fear of dogs over and over again.
Yeah.
I've looked up the etymology of it, and I can't find it.
Okay. You, Sydney, you guessed D, right?
Did you guess dogs?
Okay.
You did. You
Do I
win.
win again?
Yeah.
Just made me a winner.
Good for you. All right. Let's go on to our next question. My therapist is in a band. Hi, guys. Usually podcasts with loud off-subject banter make me cringe and I turn it off, but you guys were different. That's awesome. Thank you very much. I was hooked from the start. As a therapist in training, I really appreciate your combination of seriousness and humor on all subjects. Anyway, on to my point. I don't know if I really have a question or if I'm just seeking opinions, guidance, concerns, whatever, but I have an internal dilemma I've never been able to fully come to terms with. I've been seeing my therapist for well over a year now, so I would say our therapeutic relationship is pretty well established with its own ups and downs. A few months into my therapeutic journey with them, I was internet stalking them, not in a creepy way, on my downtime and found out that they were in a local band as well as used to be in a band fairly well known. I'm out of the area. I don't know what that means. Fairly well known. I then proceeded to binge every YouTube clip I could find of them, playing as if I were a lovesick teenager. I did admit to my therapist that I found all of this out, and I felt like I didn't deserve to be in their presence because they were way cooler than I'd ever be. My therapist has basically taken the stance of not wanting to spend too much time talking about themselves and quickly shifts any question I do about it to a different subject, which as a professional I totally understand, but as a client is annoying. One time I noticed that they were playing a live show and I really wanted to go because I do genuinely like their music, but I wasn't sure if it was appropriate. I asked a few friends of mine their opinions and got a mix of answers. Some saying, sure, why not? Others saying, absolutely not. I did end up asking my therapist directly for permission, which they did say they didn't see a problem with it, but did confirm that they wouldn't acknowledge me first. I did end up going to the show with a friend of mine and actually awkwardly said hi to my therapist while I was there, immediately regretting it and feeling horrified. That was a fun conversation in my next appointment. Anyway, all of that background to ask you all if listening to my therapist's band's music is appropriate, and if going to a show every once in a while sounds kosher. In a small way, I feel like I'm sneaking around doing something I'm not supposed to be doing. Thanks. Pronouns, she and her. So,
I know if Jim were here, he would hate this.
okay.
If Jim
All
were
right.
here and
All
if
right.
Jim were in a band, Jim would not want you to know that he were in a band.
All right. So, go ahead. Be Jim.
All right.
Give us your best Jim. Okay, so
I'm Jim. Look at me, I'm Jim. Look at my mustache. Oh, Jim, Boy Scouts, Jim.
Oh, it's like he's really here.
Oh, my
Can we
mom
just
makes
fake
excuses
Jim
for me.
real fast? Can
My
we
name's
all fake
Jim.
Yeah. Oh, yeah. You want to go? You want to be Jim for a minute?
Yeah, he would be like, "Do not do that."
Yeah.
I'm telling you, it's bad for your health.
Okay, so Jim would say no.
Yes.
Jim would be mortified if you found out that he was in a band,
If he was
first of
in a
all.
band,
Yes.
Yeah.
And he would be I believe if you went and saw Jim's imaginary band, which I believe is the name of the band, I believe he would immediately quit the band.
Oh,
Because
God.
we all have lives behind our lives, you know.
Right. I
Hey.
believe this would be cause for Jim to quit that hobby.
Listeners, go ahead and tweet us at PodTherapyGuys the name of Jim's imaginary band.
Yes.
Please.
God.
Yeah,
really,
bring it.
Oh my
I
God.
cannot wait to hear
That's
this.
gonna be a thing. That's
Hashtag
gonna
Jim's
be-
imaginary band.
Yes.
Yeah.
And we'll all go watch the show.
Send them.
I'll be
That
in the
being
front row.
said, Jim is a crazy person.
Yes.
And so don't take what Jim would or would not like to mean anything.
Yeah, this
Yes.
is third-party information.
I think your therapist handled this in a very appropriate way.
Yeah.
Number
yeah, of
one,
course.
you brought it
Yeah.
up to your therapist, which I thought was really
Which
cool
is awesome.
and very brave of you
Yes.
to do. I don't know if I'd have the guts to do that. But good, you must have a really good relationship with your therapist to bring that up. So you asked how your therapist felt about it, and your therapist did the exact right thing, which was
Cool.
cool. And letting you know
Yeah.
I won't acknowledge you first. And
Yeah.
for listeners out there who aren't really familiar with this is for confidentiality reasons, because this is just kind of something we're all taught as therapists. If I'm walking through the grocery store and I see a client of mine, I have to pass by them as if they are a complete stranger. I
Exactly.
cannot say hi first.
Yes.
Now, once somebody says hi to me, I can say hi back.
Yes.
But the reason why this is set up this way is because if I said hi to that person, and then that person is with their significant other, and then that person asks, well, who's that? Then now it puts them in a situation where they have to try to make something up,
Or they're with someone that doesn't know they're in therapy.
Exactly.
It's
It's
a
a-
protection of confidentiality.
Yeah.
I tell my clients the same thing. If I'm walking in Walmart because I'm from a small town, and I said,
Oh,
if I
yeah.
see you, yes, because I meet my clients all the time,
Yeah.
and so I say, if I won't acknowledge you, but if you say hi, I'll say hi to you, but I'm gonna act like I don't know you.
Yeah.
And I tell them that right up front.
Yeah.
And I would assume that even after they say hi, the response is not like, "Oh, hey, how you doing? How'd you progress after our last session?" Like,
Yeah.
it's not an immediately like, "Oh, hey, I know you from my therapy practice."
Exactly. And
Yeah,
it's always
yeah.
something you always have to keep it so general and so vague.
Yeah.
Yes.
And I've
mhm.
even had the situation too where I've run into a client and I was with my significant other. And so they said hi, so I said hi back, and as we walked away, then my significant other says, "Oh, who was that?" Or how do you know that person?
Oh
And,
yeah. When you run into your therapist,
yeah. And so
you do like a wave, quick, really.
I would just say I know them from work.
Yeah.
Or I've worked with them. So it doesn't
Right.
necessarily indicate therapeutic relationship.
Yeah,
It could be
absolutely.
anything.
Yeah.
Yeah.
I
But
agree
now the
100.
nice thing is like that I think when that did happen, it was somebody who I was in a new relationship with. But for the most part, anybody I'm in a relationship with knows that they just don't ask
Right.
because
It's an understood.
it's kind of an understood
Yeah,
thing. I
yeah,
can't talk about
yeah.
that. But all right. So anyway, sorry. Back to the question. The other thing that I like that your therapist did is keeping the focus on you and not talking about themselves, because that sometimes is can be a distraction in therapy when we start talking too much about the therapist and the therapist's life.
Mhm.
You're not there paying that money to hear about your therapist's life. The focus is on you, as
yeah.
it should be. So your therapist did a good job of kind of diverting it back. And it wasn't because necessarily that they just didn't want to talk about it. It was more just out of respect for you and
They're at work.
respect for your time.
Yeah.
Exactly.
Yeah.
Don't take it personal.
Yes, definitely.
Yeah.
So overall, do I think that this is a terrible thing? No, I
No.
don't. I don't see this as being anything that you should really spend too much time worrying about. Your therapist is okay with it. I don't think it's anything that is really warranting a whole lot of concern.
Yeah. And you didn't say this, but just know, like, kind of based on everything that Nick and Sydney were just saying, like, don't expect this. And again, you didn't say this, but I'm just saying it anyway. Don't expect this to then like take your relationship with your therapist to a different place.
Yeah.
Because it sounds like your therapist is doing a really good job of keeping that relationship where it's supposed to be.
Yes. Yeah. Yeah. I mean, I wouldn't go to
Like, you're not going to be pals.
Yeah. Yeah. And you know, don't become a groupie. You know,
Yeah.
like I wouldn't.
Yeah,
I
yeah.
wouldn't start showing up at
that's a
every
little,
show.
Yeah, yeah.
know, I
And don't show up at your next appointment wearing the T-shirt from your therapist's band. Maybe don't buy the
Or
T-shirt.
Maybe just hide in the back if you're gonna go.
Yeah. Don't buy the
Just
t-shirt.
like play it cool in the back.
Yeah. Exactly. Yeah. I mean, be respectful.
But it sounds like it's a
still
great
have some
therapist,
boundaries. Yeah. Yeah.
Yeah, yeah.
Otherwise, you wouldn't be,
Yeah, I'd say be aware of the
Putting 'em on
boundaries
that
that,
level.
that your therapist is setting for you. Which and I think those are good boundaries. And yeah, I mean, go to the shows if you want to go to the shows and hang out, listen to the music, enjoy the music,
Yeah, just sit in the back
and
row.
let that be it.
Yeah.
Don't try to take it to a place that it doesn't need to go to. Just enjoy
Yeah.
the music.
Yeah, I think if you start really, I think when you think of your therapist, you should think of them primarily as your therapist. I think things.
Picture them in tweed,
Yeah, exactly.
elbow patches, tweed.
Elbow patches, tweed with a pipe.
Yep.
Regardless if they're
dapper
male
hat.
or female. Yeah,
I missed that joke.
it's a long running
Probably
gag.
another one. Okay.
No, it's a long.
But yes,
The way that
yeah.
we always describe therapists is we always describe them as wearing tweed jackets with elbow patches, a pipe that they're smoking.
Looking
Always-
looking
Like
at the
Freud.
textbooks.
Yeah,
I was going to say,
exactly.
yeah, looking at a textbook picture of
Yeah.
Freud.
Yep, textbook
Do it,
picture.
next time I come in, do I need a pipe?
Yeah.
Please.
I can bring a
Please.
peace pipe.
There you go. Yeah.
See?
Oh shit! I should have
I
asked you to
know,
bring
I
that. If I'd
would've.
thought about
oh my
this.
gosh, I'm
All
some
right.
sage.
Anyway, what was I saying? Anyway, your prime when you think of your therapist, you should primarily think of them as your therapist. One thing I would caution you on is if you start thinking of your therapist and your first thought becomes anything other than being a therapist. If
Yeah.
you start thinking of your therapist as being the lead singer for this band,
Yeah.
then now it's starting to change the dynamic a little bit, and that would maybe concern me a little bit. But I don't see that as being a huge issue at this time.
You-
Where
you
you're at
have-
right now, I think is fine.
You've been given a fun little peek into your therapist's personal life.
Right.
And I would say just experience it as that.
Yes.
Yeah.
It's a fun peek behind the curtain,
That's a good way to put it.
and it's just like,
I like it.
you know,
Yeah.
hey, now I know this thing about you. It's something that's part of your life. You didn't really mean to share this with me, but it's been shared with me, and so now this is where we live, and just go from there, and just be mindful of that.
Yeah, I
And-
think that's a
yeah,
good point.
Agree.
If you leave it at a peak, that's good. If you start wanting more behind the scenes access, I think that becomes a problem.
And paying attention if you start to get a little obsessive
Mhm.
too.
Yep.
Like if it
Yeah.
becomes time consuming and you're spending a lot of time and doing all that, then just be aware. Be
Yep.
careful. That's
Yep.
it.
Don't ask to be in the band. You're not going to be in the band. Don't ask to be a roadie.
Need help carrying all that equipment?
Nope, nope.
No? Oh, okay. All right.
But
Especially if they're a
it's
singer. It's just a microphone. They don't need help.
That's what they like to do in their spare time.
And
That's it.
lastly, I just want you to know that just because you're not in a band doesn't mean you can't be cool. You said
or you
said
can't be in a band.
No, he said, I'm sorry, the listener, she said, I didn't feel like I deserved to be in their presence because they were way cooler than me. Being in a band doesn't necessarily mean you
Make
were
you
cool.
cool.
Case in point, I was in marching band for 3 years. And
That's
I
not
was
a
not
band.
cool.
It's not a band.
It's a band.
No, it's not.
It's a band. I mean, we
Nobody
played music.
thinks of formation marching when they say the words a band. That's being in band.
I don't know if you can say
You were
nobody.
in parades
Yeah.
Yeah.
and stuff,
As someone who knows a
kinda
lot of
popular.
people in bands, there are plenty of not cool people in bands.
Yeah, that's true. True. So you're cool just the way you are. You deserve to be in their presence.
Don't lower yourself.
Exactly. You're
Yeah.
doing great.
Everybody's everybody.
Thank you for that letter. That was
cool.
entertaining. Like
Yes,
that
it
one.
was. I wonder who this therapist is.
I got it.
Gene Simmons. It's
Well, we
Gene
know it's
Simmons.
not Jim.
Just kidding.
You know it's not Jim. All right, but we are at the end of our show. We want to thank everybody for listening. We don't have any announcements other than, again, congratulations to Andrea Anderson for winning our fantasy football. And you still haven't gotten your T-shirt yet because I still haven't designed it. It's on my list of things to do. Please hold me accountable to that, because I will forget, but I have so far been able to remember. I just haven't been able to do it.
If you see Jim wandering around the woods somewhere near your
Without a
home,
leg.
just let him keep wandering. Don't approach him. He may be rabid.
And and if you don't hear from us next week, we're looking for Jim.
Yes.
I'm not looking for Jim.
I can't wait to ask him next week how the rabies came out. Like,
Yeah.
how he's doing with that.
Oh my gosh.
That'll be fun.
Oh.
Something
for
about
having me, though.
skinwalkers.
We've got no new therapals, theropods, or therodactyls, but we do especially want to thank our theraproducers. Thank you, Smitty Scoop, Jake Schneider, Robert Brownie Jr. Mint, Kayla Lansbury, Judy Schneider, Nathan's Hot Dog Scoop, King of Student Loan Debt, Dr. Ben Dawn, Crazy Banana Scoop, Mason Miller, Carolyn Albert, Leon Kassab, Kevin Chamberlain, Malia, Richard Macy, Cindy Ash, Newstick, First of Name, Breather of Fire, Dumb of Ass, Lord Colin Stewart, Dirty B, Ben Stanley, Sammy Scoop, and Sarah Smith. And if you would like to hear this episode uncut and unedited,
And why wouldn't you?
and enjoy our spontaneous side projects, go to patreon.com/therapy. And thank you for supporting mental health. That's all the time we've got for this week's episode. We want to thank our landlords, the Ice Cream Social Podcast, and thank you to all of those who contributed to our show today. We really appreciate it. Remember, pod therapy isn't something you should keep all to yourself. You should share it. Share the episodes with someone who needs it by opening this episode's description in your podcast app and copying and pasting the link provided into your social media. Don't forget, you can find us on facebook.com/therapy, on Twitter at PodTherapyGuys, and now, no, we've always been on, I haven't updated the script in a long time, patreon.com/therapy. We're also on Instagram, I think at PodTherapyGuys also. So,
Probably.
so check that out. Do you want to submit a question to the show? Ask anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. I'm Nick, and that's Sydney. Thank you.
You're welcome.
And thank you all for whatever. And we'll see you next week.
Maybe.
Nailed it.
Yeah,
If we find
nailed
Jim.
it.
Nailed that outro.